Marvin Amen. I'm one of the medical residents at Kettering Health Network, now known as Kettering Medical Center. So I'd like to discuss with you a unique case of Shone Syndrome. So in this situation, Shone Syndrome is essentially a collection of 8 lesions that is placed on a continuum, and it is a range of symptoms and issues. It is approximately in 0.6% of all congenital heart diseases, and it carries various left-sided obstructive heart lesions. And so there are typically 8 of those conditions that would make up the diagnosis, but while it is on a spectrum, we classically describe 4 features that would explain or that would include a mitral ring, a parachute mitral valve, subaortic stenosis, and coarctation of the aorta. And so when patients have at least 3 of the 8 lesions, this would be classified as a partial type. However, when 4 features are present, then the complete type is essentially diagnosed. And when we look at situations prior to the year 2007, approximately less than about 100 patients were reported in the literature. And so given that this condition had an 89% mortality rate and that it had such severe mitral valve stenosis, it was found that this severity of the mitral valve stenosis is the main predictor of prognosis. And given that this is so interesting and so rare and relatively newly described, we have a patient with this typical situation that I'd like to present. And so this is a 57-year-old male. Really only past medical history is chronic kidney disease stage 3A, and he had initially presented for a 6-month history of worsening dyspnea on exertion. And classically, NYHA class-wise, he was described as 3 symptoms. And so given the lack of knowledge of what had caused this presentation, a transthoracic echo was performed, and it revealed mild aortic stenosis and moderate mitral valve stenosis. Given that we didn't really know what the initial etiology was for this finding on the echo, we ended up doing a transesophageal echo to further evaluate the results. And so it was done, and the results were confirmed even further with a cardiac catheterization, but it had indicated severe mitral valve stenosis with a mean gradient of 18 millimeters of mercury. Not only that, but also a parachute mitral valve, moderate aortic stenosis with a mean gradient of 33 millimeters of mercury, a bicuspid aortic valve, and a subvalvular septum. And so, given all of these findings, this definitely put the patient in that diagnosis of the spectrum of Shone syndrome. And so we subsequently managed the patient through a multidisciplinary approach involving both not only our cardiologists but also the cardiothoracic surgery teams. So it was definitely a multidisciplinary approach. So as a result, our patient underwent a chordal-sparing mitral valve replacement. Not only that, but also aortic valve replacement, utilizing a 21 millimeter Onyx mechanical valve and resection of the subvalvular mitral web. And so these images that we are looking at down below, figure 1, it's simply a personal long axis view of the echocardiogram that we had obtained, simply indicating a parachute mitral valve, and where we see the tendon A attaching to one of the papillary muscles. And then down at the bottom, we can demonstrate Shone syndrome features by describing the classic 4 features of number 1, supravalvular ring, a parachute mitral valve, a subaortic stenosis, and possibly a coarctation of the aorta. So, in summary, the partial Shone syndrome is quite rare. And so, data regarding long term follow ups of surgically treated patients with the partial type is lacking. And so there were several studies done, and in a study, it looked at 9 patients between the year of 2001 and 2011. And it looked at patients of about 38 years old, plus or minus 8, who were referred for valvular heart disease. And so, in 45% of the patients, mitral stenosis was found. In 22%, mitral regurg. Aortic regurg had about also 22% of the patients. But in 8 out of the 9, they reported prior cardiac surgeries such as coarctation repairs, aortic valvulotomies. But redo interventions, on the other hand, was very common in those described patients. About 25% of these patients had required a mitral valve replacement, repair, aortic valve repair, or a subvalvular aortic ridge resection. So one of those patients, refused surgery, but further literature review, we did end up being able to see that the patients who were surgically treated before the age of 5 years old, they're essentially approximately 87.5% had favorable outcomes, survival benefit of approximately 100%, and in terms of event-free follow-up was about 23.6 years, which is quite fantastic, and very promising. So in patients with partial Shone syndrome, as in our patient, definitely favorable surgical outcomes were observed, that were free from major adverse clinical events. So, in summary, I'd like to bring up this specific situation to indicate that more awareness, more research needs to be placed on this specific syndrome, especially the partial type, and that further research needs to be conducted in terms of surgical outcome and surgical follow-up, in terms of mortality benefits, clinical benefits, and adverse events in the future when proceeding with surgical treatments versus medical treatments in such patients. Thank you very much for taking the time to review this case with me.